Today we're getting under the hood of women's health with Dr. Taniqua Miller, a board-certified OBGYN and women's health physician, empowerment coach, a midlife menopause health expert, and the founder of Revival, a menopause telemedicine company. Dr. Miller will get under the hood of perimenopause. What are the first signs of perimenopause, and how do I know if I'm in
Such a
it?
great question because perimenopause can be really nebulous in terms of how it presents for people. We know, for example, when you are entering puberty, you start having clear signs of puberty, but for a lot of women going through perimenopause, it's not so clear cut. One of the first signs, however, is just noticing subtle changes to the menstrual cycle. And this can look a lot of different ways. For someone who's had really regular menstrual cycles, maybe every 28 days or every 30 days, all of a sudden you start noticing some variability in your cycle length. So maybe you go from 28 days to now 26 days to now 24 days. That could be, in fact, indicative of those slow hormonal changes in early perimenopause. For some others, as you start going a little further into your perimenopausal journey, you might start having what we think of more of the classic signs of estrogen decline, namely vasomotor symptoms. So, thinking of hot flashes or night sweats, or even generalized sleep disruption. But for many people, their symptoms can also come in ways that are really unexpected, like fatigue, which seems really general, or brain fog or mood changes, increased irritability, or worsening PMS symptoms.
At what age does perimenopause begin?
In the United States, the average age of menopause is about 51. And we say that that menopausal transition or that perimenopausal transition is on average 4 years. So that give or takes about mid 40s. However, we know from several studies that the range of perimenopause, while on average is 4 years, can be as long as 10 plus years in some groups.
How long does perimenopause last, and what factors can affect its duration?
On average, perimenopause is about 4 years, but of course, that's just an average. It's very variable for many different groups. And in fact, we know that perimenopause can be as long as 10 years for some. There are lots of different factors that will predict when women will experience menopause, some genetic. So we always want to look at our female family members to see when they themselves have gone through the menopause, but then also environmental, namely smoking habits, which tend to um, decrease the time to menopause, or even other factors around when you've started your period, how many pregnancies you've had, etc.
What are the most common symptoms, and how can I manage them naturally or medically?
Some of the common symptoms during perimenopause, especially, would be cycle variability. And it's nothing wrong with cycle variability unless you're experiencing lots of unscheduled bleeding or mistimed bleeding, heavy vaginal bleeding that could put you at risk for things like blood loss anemia. And sometimes that presents as changing pads on the hour or having a prolonged menstrual bleeding period greater than 7 days. Then we think about some of the other more systemic symptoms, such as hot flashes, night sweats, poor sleep, contributing to that poor sleep, which can have a profound impact on your ability to concentrate, which for many women can present as brain fog, as well as some mood lability, more irritability, feeling like there's a worsening of your PMS symptoms that you may be experiencing or maybe have never experienced at all. Some other women will also complain of weight gain, especially around the midsection, that seems really stubborn and hard to get rid of. And we know that as estrogen levels start to fluctuate and decline, we do get a redistribution of our body weight to our midsection, which can have other health consequences like insulin resistance. So, for those who want to address those symptoms, things that can help include exercise and nutrition as really lifestyle factors that are tried and true. We realize that our diets do have to change, and we generally recommend more of a protein focused diet, as we know that with age, there is that increase for insulin resistance. We also make recommendations for exercise to just alter some of the things that you're doing. So, a lot of us really like our cardiovascular exercise, but we also encourage, if you're not already doing strength training, to add that in. In fact, the American Heart Association recommends about 150 minutes of aerobic exercise. So, that's about 30 minutes, 5 days a week for weight maintenance, but also the addition of strength training at least twice a week. We also recommend good sleep hygiene, and that looks like making sure that you're going to a stable time to bed, uh, refraining for using devices in the bedroom because of that blue light activation, and really minimizing the amount of stress, whether that's through mindfulness practices or the like, to really help mitigate some of that stress that we experience. And we know that all of these things, in addition to some of the treatments that we offer medically, can in fact help. Now, in terms of medical treatments, which I know we'll talk more about, including hormonal therapy, that still is considered standard of care for those who are experiencing vasomotor symptoms, especially of the menopausal transition, aka perimenopause.
How does perimenopause affect mood, anxiety, and mental health?
For many women, they may experience their first episode of anxiety, irritability, or depression in the menopausal transition, aka perimenopause. In fact, some studies show that 40% of people going through the journey will, in fact, have their first experience of anxiety or depression. And we really believe it's related to just the impact of estrogen in the brain. So, if you could think about the normal menstrual cycle, that second half of the cycle that's dominated by both estrogen and progesterone, if there's no pregnancy, those levels decline. And when those levels decline, they have a direct impact on the neurotransmitters in the brain, such as serotonin, which we consider that mood stabilizing transmitter. So, as those hormonal levels drop, there's also a decline in serotonin in many cases. And for some women, it's fine. It's well tolerated, either with rest, exercise, or any other way that people will cope with some increased irritability. But for some, it can cause significant symptoms of anger, sadness, irritability. And that's what we think of as PMS. Then we think of symptoms of PMDD, which are these symptoms so intensified that they're interrupting daily life. And what we notice is that this happens on a very cyclical basis. Well, when you're in perimenopause and there's a little bit more cycle variability, there's a little bit more variability in the release of estrogen for some people. If you can imagine, their neurotransmitter environment is also greatly altered. So for some, they might feel like, hey, I've had episodes of PMS, or maybe even have been treated for PMDD in the past, and it was predictable, and the tools that they had at the time worked really well. But when you're entering perimenopause and there's actually that change in the level of hormones, for some, the tools that used to work in the past no longer work, and that can cause some significant disruption to their lives from an emotional standpoint.
Will perimenopause impact my weight, metabolism, or ability to maintain muscle mass?
For many people going through the perimenopausal transition, they will experience some stubborn weight gain. And in fact, we think on average it's about 5 pounds of weight gain, although many of my patients definitely notice more over the years. And this can be for a lot of different factors. The first thing is as estrogen levels decline, we see a rise in cortisol levels as well as insulin levels, generally in the setting of insulin resistance. We know that insulin resistance makes it more difficult for our body to process carbohydrates, for example. And so it takes more insulin to get the same response. And as a result, when insulin is doing its job, it's shuttling all of that extra carbohydrates into fat storage. Same too goes for cortisol. If you're experiencing sleep disruption or having other symptoms of vasomotor symptoms or other just general midlife stressors that can occur during this time, cortisol levels can actually remain high. And cortisol is a great survival hormone in that it will encourage fat storage. It'll even encourage sweet cravings. Well, guess what? All of those extra calories or that fat storage can, in fact, contribute to weight gain. We also know that as estrogen levels decline, so too does testosterone levels, because testosterone is primarily produced in the ovaries as well during the years of cycling. And so that loss of testosterone can also impact just how well we're able to hold on to muscle. So, what we generally recommend for midlife, as you're going through perimenopause, especially for that muscle development, that you eat greater proportions of protein to encourage that muscle maintenance, but then also increasing some of that strength training that we talked about.
What role does hormone replacement therapy, HRT, play, and is it right for me?
Some women going through the menopausal transition, they may have symptoms that are so bothersome that it's really disruptive to their daily life. And really, what we want during this phase is a good quality of life. And for some, that can be managed with some lifestyle changes, some dietary changes, changing the way that we're exercising, moving our bodies, adopting good habits for stress management, and really abiding by good sleep hygiene. But for others, sometimes these symptoms become so unbearable that they really do affect our and disrupt life. And that is when we would consider things like menopausal hormone therapy to help. We also know that menopausal therapy is an FDA approved option for the management of vasomotor symptoms of menopause and has a lot of good safety data in the right patient. As someone who prescribes hormone therapy, I generally will ask what the patient's goals are. If hormone therapy is something that they wish to try, understanding that it's not something that they're on for a lifetime if they don't want, and we can always work to tweak the regimens to make sure that we're fitting in with their goals.
If you were to give 5 tips for women experiencing perimenopause, what would they be?
I always joke that there is no class that we're given for perimenopause. Unlike in middle school, where we were separated and learned all about puberty or even pregnancy, where you have 12 doctor's visits and lots of different communities that you can join to understand what's actually happening during for your body during the pregnancy transition. We really don't have that for perimenopause and menopause. And so here are my 5 tips to really feel empowered through that journey. The first is become an informed person about your body. There are so many great resources focused exclusively on the menopausal transition that are easy reads that you can pick up from your local library or your local bookstore. Sometimes it starts with just knowing what to expect and understanding that it's not all period stopping and hot flashes, but it can really impact very many different facets of your life, like we discussed weight gain, mood changes, brain fog, and sleep disruption. The second thing that I would recommend is be in community. We cannot go through this journey alone. And in fact, many of my patients feel so isolated as they're experiencing symptoms that seem really disruptive and make them feel like they don't even recognize their bodies or themselves anymore. When you have community where you can meet, where you can bounce ideas off of, where you can share resources, I find that that makes this journey feel less alone than than it has to. Number three, I want you to be really picky about who you partner with your menopausal care. For so many people, we know that, unfortunately, I'm a clinician myself, that many clinicians may not have the expertise to really help patients walk through this journey in a way that feels empowering, really discussing all of the options and focusing on that goals oriented, patient centered approach. And so, for many people, you've been with your gynecologist or your primary care physician for years. They've helped you through talking about contraception. They've helped you through pregnancies. They've been with you at the highs and the lows of your reproductive journey. But that person may not necessarily be the right person to help you navigate this transition. So if you feel like you're not getting the input that you want from your clinicians, that's okay. I would recommend that you be really picky though and seek out someone who has an expertise in menopausal medicine, someone like myself. I'm a certified menopause specialist, certified through the Menopause Society. And the website menopause.org actually has people just like me listed on the site by zip code that you can search out and schedule a consultation with to feel as though you are being well managed during this transition. Four, bring your family along for the ride. For so many, this seems to be a time of shame because you don't know what you're going through in your own body, but then it also is a sign of you getting older. And in a society where being young is valued, that can be really, really isolating. But what I find is that partners and children, they want to know what's going on with you too. So talk to them. Talk to them when you don't have it that day. Talk to them when you're feeling exhausted. Talk to them when you feel really irritable and feel like you have a low patience meter and you just don't know why you kind of flew off the handle. Let them know that you're going through this transition and make them feel a part of your journey as well. And then number five, find a place where you feel good in your body again. And this is not necessarily having to do with weight or um, getting any sort of like aesthetic stuff done. This is about feeling good in who you are and the things you enjoy. And I'm a big proponent in this way of finding your new pleasures. Now, when we think of pleasure, we specifically kind of go to like this idea of sexual pleasure, but there's so many different pleasures in life. And I think midlife is such a great time to explore those, whether it be taking that dance class that you wanted, or that painting class that you've been thinking about, or even just joining a book club because you want to get back to reading. I really encourage you to find a little bit of joy during this journey.